My name is Cassidy Beatty, and this is my interview video reflection assignment for Psych 491 at Liberty University. For my assignment, I interviewed Ashley Parks, who is a licensed behavioral health therapist with the Psychiatric Emergency Response Service at Sentara Hospital in Virginia. She has a Bachelor's of Science in Psychology from Liberty University and a Master's of Education in Clinical Psychology from Old Dominion University. She's worked in lots of positions in both outpatient and inpatient care, but this interview primarily focused on her current position in inpatient care. Now, her main responsibility at the hospital is to provide level of care assessments for incoming hospital patients. This involves risk assessments and the use of a modified Columbia suicide scale, as well as diagnosis. Most of the patients she sees come to the emergency department for mental health issues or drug issues. Ashley helps to assess the type of care they should receive after about a 20 to 30-minute assessment with them. She often deals with unhoused patients, patients struggling with addiction, and involuntary patients, or people who are not mentally capable of seeking treatment on their own. For these patients, she petitions for ECOs, which are emergency custody orders, or TDOs, which are temporary detention orders. They both serve a pretty similar purpose, just allowing the patient to be admitted for treatment to the hospital. She finds lots of aspects of the job fulfilling, particularly the flexibility it allows her. So Ashley is able to work from home and meet with patients via video calls. And because of this, she's able to help people while still being available for her husband and 2 children. Having a family is very important to her, and it really helps to balance out the stress of the job as well, that she's in a safe and comfortable environment. The removal from a physical workplace definitely helps mitigate some of the mental health difficulties that come with this kind of job. Now, within the job itself, she finds it particularly fulfilling when she's able to calm new patients who are nervous about receiving inpatient care. There's definitely a very negative stigma around inpatient care, some of it warranted, but most of it not. And new patients are very aware of this stigma sometimes and can be pretty anxious to enter inpatient, even if they know it'll be beneficial for them in the long term. It's a very scary thing. But Ashley loves being able to reassure them with her own experiences and help in breaking down the stigma towards inpatient care, one patient at a time. On the flip side, she often has what she calls frequent flyers, or patients that return often to the hospital. Now, these patients are usually unhoused or struggling with addiction, so it's really nice for her when she's able to see them return in a better state than the first time that they saw her, or when they return before they relapse or cause harm to themselves or others. In that way, they were able to feel safe enough to come back to the hospital before a crisis situation, and Ashley knows that she was able to have a hand in setting them up for success the first time they visited, so that they felt safe in taking on the responsibility of going back to the hospital and getting the resources and the help that they needed. In that way, it's definitely a lot like harm reduction, in that they can come to the hospital before a crisis happens. Now, in that same vein, it is sometimes very frustrating to see frequent flyers, especially if they've declined more since the last time she saw them. It can be really disheartening after a while for Ashley to see the same faces over and over again, knowing that she's doing all she can to help and it still is not enough for someone. Often she has to eventually decide whether or not these people are misusing hospital resources, usually in the case of unhoused people who are just looking for shelter and a meal, which is very difficult for her. She claims that her job naturally creates enemies because of this, and she has had patients approach her when she's out with her family, just in public, off the job, to personally ask her for resources, generally financial resources. Very different from them coming to the hospital, of course, in the context of her job. And because some of her patients can have dangerous tendencies, this aspect of the job can be pretty scary when she's out with her kids, especially. Um, Definitely a downside. In addition, a lot of the diagnoses that she gives tend to be for cluster B disorders, which are notoriously complicated and difficult to treat. So these patients are often frequent flyers who pose a danger to themselves or others. The job can be very taxing when dealing with that kind of diagnosis all day. Um, she says that sometimes after work, she just holds her children for a while to decompress from hearing awful stories from these patients all day, and definitely understand how working from home would be a plus in that aspect. On a lighter note, she keeps up her knowledge by doing continued education trainings required by the hospital. Outside of that, she connects with other professionals often and tries to keep up with new studies and keep up with her DSM knowledge on her own as well. And due to the nature of her job, Ashley also frequently has to take ethics classes through the hospital just to make sure that everything is up to ethical standards. Ashley's advice for young professionals just starting out in the field was to start from the ground up. For her, this included working for the CSB, or Community Services Board, and doing in-home care and assessments. She started working in emergency and crisis situations, which gave her a good framework for the many different aspects of mental health emergencies and what they can look like in the moment. Often, people don't really grasp how certain symptoms can present in a crisis situation. So she said that starting with emergency situations can be very helpful in learning to hone instincts and just general knowledge base. She claims that in order to be successful in outpatient care, if that's your goal, it's important to lay the groundwork first by getting experience with mental health emergencies, which involve a lot of different disorders and symptoms that definitely present in different ways for everyone. It's important to do acute cases first, she said, instead of transitioning to outpatient before you're fully ready. One of the most important pieces of advice that she could give was to know yourself and your triggers, because it's really impossible to help others without taking care of yourself first in that kind of job. I definitely learned a lot from Ashley's interview, mostly practical aspects of the field that I hadn't considered before. Ashley and I were actually roommates on campus for a semester at Liberty, but after that semester, our lives just took really different paths. She went on to finish her degree and then go on to get a master's, and I moved away and put off college for a little bit. And now coming back, her job is definitely different than what I thought my job might be like when I started my psychology degree. I had originally wanted to go into psychological research and thought I wouldn't have all that much need for practical knowledge of psychiatric care. But my career goals have changed now, and Ashley's experience was actually pretty invaluable. The aspects of the interview that stuck out the most to me were her characterizations of difficult or dangerous patients and her emphasis on self-care. I personally aim to destigmatize and treat cluster B disorder specifically in my work, so hearing her practical experience with those patients sort of took off my rose-colored glasses in a sense. Most of my experience with cluster B diagnosed individuals have been with people who've been actively working for years to treat their symptoms and improve their lives. Ashley's experience is with the first steps of that process for individuals in active crisis. It's very different from patients who are aware of their diagnosis and are purposely seeking treatment for it. In addition, the way that she spoke of self-care made it seem imperative to her work. I've always been of the mindset that, and it's often to my own detriment, that self-sacrifice for noble work is necessary, but this can be a pretty unhealthy belief. Ashley, for example, only takes 4 cases of 20 to 30-minute interviews a day to protect her mental health. It can be very taxing, so she looks at the patient's names before the interview, verifies that their name's correct at the beginning, and then immediately forgets their name so that she's not tempted to obsess over their well-being, or to, think about them outside of the job. And she also knows her own triggers and refuses to take certain cases, such as patients who've experienced postpartum depression with psychosis. That's very particular to her, but it definitely can be brought into any kind of personal triggers. And while it may seem like she's being too selective or doesn't care about her patients, it's not that at all. In reality, she's caring for them by ensuring that she can give them her absolute best care. It's something that I will definitely take going forward in my work.